With Hollywood Connections. My show is exciting. We have major stars, major artists, major movie producers, agents, casting directors. I even help cast for Home Shopping Network. You might be on that show as well. We have new talent segments be discovered. Remember Hollywood Connections on Saturday from 3 to 4 on Tan Talk Radio. I'm Dawn Reese, your host. Tune in.
Hi, this is Tim Del Toro.
And I'm Lou Angel Wolf, and we are the Grease Gurus.
Our show is broadcast every Saturday morning live at WTAN Tan Talk Radio 1340.
That's 10 o'clock every Saturday morning for an automotive forum that is flavored with humor and insight.
We encourage you to call in and be part of the Grease Gurus show.
We'd love to have you, and we will certainly help you find your inner grease.
This show is sponsored by Tim's Performance Service Center in beautiful Tarpon Springs at 906 Verona Place, and you can reach us personally at 727-543-1601.
Aha.
Hi, this is John Austin, host of the book club on the Tan Talk Radio Network. I spent 35 years in publishing, and today I want to tell you about a book that can change people's lives. The book is No Cash, No Problem, and the author is Dave Wagenford with Ali Pervez. Dave Wagenford is one of the greatest barter experts in the world, and he's bartered over $500 million worth of goods and services. If you want to remodel your house, but the cost is just too high, or maybe there's an automobile that you've dreamed of owning but thought you never could afford. This book will tell you how you can do both of those things, plus hundreds more with little or no cash and without going into hock for the rest of your life. Maybe you're a business owner with a cash flow problem that leads to low or non-existent profits. Read this book and see how you can increase your cash flow and your profits by time-proven techniques. The book again is No Cash, No Problem, and you can buy it now on Amazon for just $7.98 for the ebook edition. Do yourself a big favor and buy it today.
Go yard is a metaphor used in baseball, meaning to hit a home run. Life struggles can make you feel like you just struck out. It's times like these that we need a little batting practice to pick ourselves back up and get back in the game. Whether you are dealing with marital issues, drug addiction, rebellious teens, anxiety, depression, or just generally having a bad day, call Mama Mac. If life has you down 0-2, before you strike out, learn to go yard. Go yard with Mama Mac on this radio station, Thursdays, 6 o'clock.
This is the Tan Talk Radio Network.
The Karen Rizzo Show on the Tan Talk Network. This is the show for seniors, caregivers, and their families. She is the author of the best-selling book, Aging in America, Navigating Our Healthcare System, which is available at Amazon, Nook, Kindle, and at agingguidebook1.com. Having worked over 20 years in the industry, she has the insider information about the healthcare system and how it works, and will help you navigate around the business side of aging in America. She also works as a patient advocate, consultant, and educator. Now here's your host, Karen Rizzo.
Good morning. Welcome back to the Karen Rizzo Show. We're discussing the business of aging in America. We're also here to help you learn how to navigate your choices in a very for-profit healthcare system we have here in our country. It is based on the book Aging in America, Navigating Our Healthcare System, which is available on Amazon and downloadable on Nook and Kindle and at agingguidebook1.com. Every week we discuss a lot of different topics on how to choose quality healthcare providers. That's the key to maintaining a healthy and wellness plan. However, we're also featuring guests this week. My dear friend Sue Ross, who's the owner and operator of a family-owned home care agency called Always There Home Care, is in-house with us. And she's going to give us a whole bunch of tips on what to look for when a family member is needing additional care in the home, what questions to ask a home care agency, and more importantly, in Chapter 11 of the book on exploitation and senior neglect, it turns out that most of any type of exploitation or fraudulent or neglect of a senior happens in their home. So it's a very serious situation. There's so much competition for home care out there. So, Sue, I'd like to welcome you to the show, and maybe you can tell me a little bit of what got you into this business.
Well, Karen, thank you so much for having me today. Well, it's a long story, but I'll keep it really short. I'm the eldest of many grandchildren. I spent a lot of time with my grandparents. I've always had that nurturing sense. I wanted to be a nurse. Didn't do too well with needles or and blood, so I went into.
People can't.
I ended up going into the administrative side of healthcare. It seemed to be my niche and my fit.
Okay. And I know managing not only patient care needs, but also staff can be extremely, extremely difficult. Maybe, I think a lot of our listeners think that, oh, I'm covered if I have Medicare, and I'm covered forever in my home. So maybe you can answer or explain a little bit about the differences between custodial care and that skilled Medicare home care side.
Sure. It's a great question. We have a lot of people that call for information. I mean, they're a sandwich generation, so they're dealing with their children, their parents. And I'll be honest, there's a lot of folks out there, they're CPAs, they're attorneys, they're very intelligent people, but it's a, you need a degree in itself to manage through this. The difference really is custodial care is covered by private pay or long-term care insurance.
Okay.
A lot of times people will call their insurance company, even Medicare, and they'll say they cover up to 8 hours a day of in-home care. What they're neglecting to tell you is that's skilled care. So that's physical therapy, occupational, speech, et cetera, et cetera. So there is that misconception that I'm going to have some coverage. And people really need to understand that it is really an out-of-pocket in most cases, or, like I said, that long-term care.
Well, the language that I think a lot of people really need to understand is that what Medicare is going to offer, or a Medicare Advantage plan, is going to offer that, like you said, the wound care, IV antibiotics, any type of skilled nursing in a home, but they don't cover things like bathing, showers, transportation to doctors. And it's very difficult, even with the long-term care policies that are out there. There's so many different plans. So I would always urge someone, if you're looking to purchase a long-term care insurance policy, that you really look carefully at the verbiage of custodial care in the home versus skilled care in the home. And a lot of the policies written 20, 30 years ago, you really, really need to get with a financial advisor about, because some of them, they didn't always think that there was going to be certain care needs of our elders. Back then, the average lifespan in America was 70. So a lot of people that had long-term care insurance policies probably never even used most of them. So things have changed. I know from those in the financial world that I'm colleagues with that they have a lot of new products and plans. We're going to be getting a financial advisor on the show one of these weeks here to discuss long-term care, because that's such a big piece of it. So what would you say are the biggest type of people that you help on a daily basis?
I would say it varies in that oftentimes we assist maybe a spouse that is the caregiver for their husband or their wife. There may be a physical limitation. There could be some dementia or Alzheimer's going on.
Right.
So we really we offer respite for them. We oftentimes go in and provide personal care assistance because they're a little older as well, and they don't feel safe getting that spouse into the shower and taking care of those needs. And also some of them really need someone to be with them and provide oversight while the spouse goes to the doctor, the hair salon, that type of thing.
So actually, your client might not necessarily be just the client. It might be the whole family.
In most cases, it is. We deal with a lot of different personalities. And one of the things that when we sit down with the families, and of course the potential client as well, we tell them we really want to involve the client. This is a decision that everyone should be involved with. Home care is a very personal choice. And
and I wanted to just get into that, not just the matchmaker component, because every person on the face of the planet has a different personality, but also I've seen a lot of really, really serious cases through the years. One is, in my book, I mentioned Helga the housekeeper, where someone just hired somebody from church not against any religious helpful people out there, but they hired this person not realizing that now they are the employer. And in that case, actually, she had taken her mother to an attorney, written herself into the will. They had to seek legal action to even get some of their heirlooms back, and most of the family lived out of the state of Florida. So in terms of that, maybe you can get into a little bit how you select your caregivers. I know in your commercial it says a 15-step recruitment process. That seems extremely overwhelming, but tell me your logic here.
Well, when we select caregivers, the first thing that we look for is that telephone screening or telephone interview. Because you can tell, a person's compassion and empathy right off the bat just by listening to them on the phone. Of course, we invite them in, and have an extensive interview process. But what really separates us from others is we put them through a personality profile.
Oh, interesting.
We really want to determine their honesty, the type of person that they are. Do they really have empathy, or is it,
Is it a paycheck?
It's exactly. So we go through a lot of that. They go through an FBI level 2 background screen.
Okay, that's important.
Well, yes, it is. Regular level 1 as well. We put them through drug testing.
Okay.
Motor vehicle screening.
Okay.
Because oftentimes we do drive someone to the doctors, that type of thing. They're competency tested.
Okay.
We have to verify their license. We verify all their work history.
I think the other educational components that the state requires for home care agencies is the signs and symptoms of a stroke, the CPR training, the
Alzheimer's training.
Oh, the Alzheimer's training.
They have to have HIV training for bloodborne pathogens and things like that. So there's a lot that's involved in that hiring process.
Right, and I know that they usually have to have a letter from their doctor saying that they're free of communicable diseases.
Correct.
So, and these are all components that if someone hires somebody off the street, there's no guarantee of any of that education, that background, that training. Lot of people, move into Medicare running from other problems in other states and thinking that, I'll just work for some, older person and there's my meal ticket. But there's such a danger in not making sure that you know who's actually in the home, especially if they're alone, wouldn't you say?
I do. And one of the things that we offer is our registered nurses provide supervision. So they're in the home. On some of our more extensive cases, they're in every single week, just checking to make sure the care plan is the way it's supposed to be for our clients and our staff. Are there any changes? How is the care? It's nice to have that supervision, especially when you're dealing with families that are out of state. Right. And they really, there's no eyes and ears locally. So it's part of our service. There's no extra charge for it. It's just we feel that it's very important.
Well, I think it protects your client and your staff and you as an agency so that you actually know who's visiting the home. I know we're working very closely on an event in January that's all about senior fraud and helping them avoid scams. Has any of your staff through the years run into situations where people are trying to defraud them out of their money?
Oh, often. And as well as they've had that happen and they're picking up the phone and looking for an agency to come in. But we did, as little as the aide just said, geez, this lawn guy is here all the time.
Yeah.
She's writing a check to him. And, they go out and look, and there were a couple of plugs put in the backyard, and there's a $100 check going out the door every week. So, those type of things we do notice. We have to, by law, report.
Absolutely.
It's just extra eyes and ears for looking out for our seniors.
Yeah, it's definitely a protection. One of the things I found interesting, because some agencies have minimum hourly requirements. So maybe you can talk about how you structure what a care plan would be or what a client might need.
Sure. Well, we offer a multitude of services. I would say the most frequent or most common is personal care assistance.
Okay.
Usually that can be assistance with toileting, grooming, incontinence care, anything, things like that. We have a 1-hour visit.
Wow, that's
that
good.
Just, somebody might just need some help with bathing and can manage just fine.
Right.
Then we offer 4-hour blocks.
Okay.
And the reason for that is, I've been doing this for so many years. When you come to work or the aides come to work, they're looking for an 8-hour day.
Right.
So if we can offer them 2 4-hour shifts,
right,
it keeps our employees with us.
That's huge.
So we don't have the turnover that other agencies have. Because, imagine if you're a worker and you have 2 2-hour cases, that's not enough. So we can keep them busy.
Mm-hmm.
And we can start. They don't have to travel all over the county. They're just going to a couple of different locations, and they're a happier group of people.
Well, and a happy caregiver is going to make a happy patient. It's like a happy mama is a happy wife, happy life. That's the same concept here.
Very true.
But actually, they've actually shown that the happier the caregivers are, whether it's a personal family member taking care of a relative or an agency coming in that feels safe and protected and supported, that the client themselves do better, that they have less hospitalizations, they have less falls. I want to get into how a person should plan ahead a little bit on these costs, because a lot of people think that, like we were talking about, Medicare is going to pay for everything. We all know this is not going to happen. It's not happening now, which means it's going to happen even less in the future. So just to be realistic, there are different programs out there that we're going to get into in a few minutes that talk really about practical ways to pay for this kind of care. Mm-hmm. Now, hopefully, every senior never needs it. But what's the average age, would you say, of the bulk of your clients?
Believe it or not, they're in their 90s.
Wow, that's huge. We're seeing just the lifespan expand. 99.3 is what it is right now.
Wow. Well, my grandmother just turned 99 2 weeks ago. So, yes.
Oh, you got some good genes, girl.
Hopefully I got those.
Yeah.
But, yes, they are living longer. And I think one of the things that people do not really want to take a look at, I'm aging. We all want to age in place.
Right.
And making those decisions, looking ahead, realizing that, geez, maybe I am having a little bit of a difficult time. Maybe I should get a little bit of help.
Right.
Usually it's safety.
Right.
And it usually prohibits or, prevents a fall or an accident happening in the home.
Right, and I know fall prevention is a hot topic this year. This has been something that I know that in the Tampa Bay area, and specifically in Pinellas County, EMS had gone out to over 40-some thousand seniors that they were picking up off the floor, the fallen, I can't get up situation. Mm-hmm. So really having somebody there can really be a huge, huge plus in being able to protect them, in the future. I really want to get back into, when we come back, let's discuss fall prevention, and I really want to talk a little bit more about the practical ways to pay for this care, because if someone's living to their 90s, and we're seeing this all across the scope, we're seeing more 90-year-olds in assisted living, we're seeing more 90-year-olds at home. Recently I saw a 101-year-old that I was trying to be able to go ahead and get some services for. Mm-hmm. So when we get back, let's talk a little bit more about some ways they can pay for it and how to avoid that falls.
Sure. Okay.
She said, son, you're growing up now. Pretty soon you'll take a bride. And then she said, just because you become a young man now, there's still some things that you don't understand now. Before you ask some girl for a hand now, keep your freedom for as long as you can.
This is the Tan Talk Radio Network.
AJ here from the Tee It Up Radio Network, America's top golf and lifestyle show, now celebrating 22 years. Tune in Sunday nights at 6 p.m. right here on the Tan Talk Radio Network. Expect tour coverage to one-on-ones with Hollywood's most passionate golfers and much more. So stay in the know with the Tee It Up Show, Sundays starting at 6 p.m. right here on the Tan Talk Radio Network.
Hi, this is John Austin, host of the Tan Talk Radio Network's Book Club, inviting you to join us every Tuesday at noon to hear talented new national and international authors discuss their books. The program features both fiction and nonfiction titles and is sure to add terrific new books for your must-read list. If you love books, be sure to listen every Tuesday at noon for the Book Club right here on the Tan Talk Radio Network.
Hi, this is Paul Malloy, host of Freedom Works, The Paul Malloy Show, heard every Monday, Wednesday, and Friday, 10 to 11 a.m. Eastern Time, here on the Tan Talk Radio Network. Please join us and our guests as we focus a libertarian spotlight on what's happening in our politics and culture. If you thought our Constitution and the Declaration of Independence really did stand for individual freedom, then you'll be coming to the right place. Again, that's Freedom Works, The Paul Malloy Show, every Monday, Wednesday, and Friday, 10 to 11 a.m. Eastern Time on the Tan Talk Radio Network.
Coming up Tuesday on the Rocket Sports and Entertainment Network show, the New York Giants battle the Dolphins on Monday Night Football. They'll look to keep pace with the Eagles and Redskins atop the NFC East. The Tampa Bay Lightning, they're short-handed, battling injuries up in Columbus. We'll see how they fared against the Blue Jackets. Plus, we'll have Tampa Tribune's Roy Cummings on to discuss the future of the Tampa Bay Buccaneers and whether or not they can, in fact, make the playoffs this season. All that and more, afternoons 2 to 4, right here on the Tan Talk Radio Network.
This is the Tan Talk Radio Network.
And welcome back to the Karen Rizzo Show on navigating our healthcare system. This week we're discussing with Sue Ross, who's an active, very involved owner of her own private duty home care agency called Always There Home Care. And we're going through not only some of the tips that people need to know about choosing and selecting someone in the home care, but also why don't you explain to the audience and the listeners, Sue, a little bit about the involvement you have with your clients and your staff?
Well, I am an active owner. I'm also the administrator, so I am involved in every aspect. I do most of the client initial calls with the family members to discuss the different types of services that they may need, offer some insight, and sometimes, obviously make a lot of suggestions and do a lot of education because, a lot of folks don't quite.
It's confusing.
It is, and I try to kind of guide them through all that. So I do the initial home visit, and then our registered nurse comes out and they do the initial assessment, plan of treatment, plan of care.
Perfect.
And then, we go from there as far as staffing. They certainly are entitled to interviewing their staff that comes in.
That's huge.
We want them to, we want to make sure that it's a comfortable fit for everyone. Oftentimes it can be an emergency discharge from the hospital, so we don't have that opportunity. But, we do really try right off the bat to, make it a nice fit just by asking some questions. But,
right. And I know that sometimes when a person is discharging from the hospital or a rehab center, it can be so sudden. Mm-hmm. They just, yesterday they're settled, they're fine, they're being taken care of, and guess what? The ugly lights come on and you need to get out tomorrow. Mm-hmm. Do you offer any, do you get a lot of patients in that setting where maybe you take them to get their medications, make sure that the food in the fridge is taken care of, some of those different programs?
Yes, we do offer, it's a 4-hour one-time only plan where, yes, we can, pick them up from the hospital, and that's provided they're not wheelchair bound.
Right,
pick
of
them
course.
up, get them home, kind of clean out that refrigerator because they may have been in for a few days, change the bed linens, and we really, get to the store, do some things like that. It really is it's geared towards what the need is, but we do offer that one time only.
That's a lot of agencies don't offer that. That's really a great program. So any of the nursing homes and hospital people listening, remember Always There Home Care can take care of that person that's discharging and we don't know how to get them home and what the home care condition is going to look like when we get there. So that's a really good program. Now, you had talked a little bit about fall prevention, and I know that's a big hot topic. I know when your nurse comes in to do the plan of care and plan of treatment, can you talk a little bit about the home safety eval that I think so many of our elderly people don't necessarily do voluntarily?
Yes, they think that holding on to the furniture, they're still getting around, really, really well. Yes, we want to make sure that they're, and this is more towards occupational therapy, we want to make sure they can reach up to the cabinet. We want to make sure they can safely ambulate in the home, even if it is with a cane or a walker.
Right.
We want to see, can they stand for periods of time so that they can do some meal preparation and things like that. It's very important because oftentimes, they're quite capable of staying in their home. They just maybe need a little physical therapy.
Right.
So we discuss that with them, and we make that referral to the doctor so that they can safely stay at home, and maybe we provide a little bit of intermittent care.
I had a woman a couple of years ago that I was working with, and she was, bless her heart, 101 years young, and her home had a line of boxes from her bed to her bathroom, and that was her fall prevention. And she tripped over one of those boxes in the middle of the night going to the bathroom and fractured her hip, bless her heart. But when I noticed that when the private duty agency came in, they cleared the boxes, picked up all those rugs that matched the towels, that matched the curtain that we're not allowed to use, kind of streamlined it so that it was safer, got her the right shoes, got her the right equipment so she could safely use the bathroom and stay comfortably at home. So I know fall prevention is a huge thing. It is the leading cause of seniors ending up long-term care in a nursing home. So for those that want to stay home, which really, who wants to be in a nursing home? No one. We all want to stay home. Carefully looking at your situation and just kind of giving some attention to the things in the house that could present a stumbling block can be the difference between staying at home longer or ending up in a hospital or possibly a nursing home. So I know I have some other colleagues that, and I applaud all of my home health colleagues because I know the difficult job you guys have, and it's a 24/7 job. These phones never turn off. If somebody needs help in the middle of the night, there's a call. There's always somebody on call for that. But how would you explain the differences between like just a cleaning service and what you do?
Certainly. One of the things that we do, and we, like I said, we run the motor vehicle screening. It's because we provide incidental transportation.
Okay.
So that means we can go into the home, provide some light housekeeping, and by light housekeeping, that means some dusting, vacuuming, cleaning the bathrooms and cleaning up the kitchen. And oftentimes, they'll want us to wash the windows and take the drapes down and do some different things like that. But that's really not part of that light housekeeping. We do meal preparation. We take them to appointments, errands, things like that. That's more of what our homemaking tasks do. Laundry, linen changing, that kind of thing.
Yeah, and I know, like I said, I've worked with other people where sometimes the expectation is, well, I can hire a private duty home care agency and they're going to clean out 20 years worth of hoarding and maybe boxes and magazines, and this is not the role, guys, of a private duty home care agency. This is really someone who's sent into the home, who's either a CNA or a medical assistant, who's had that training to do hands-on care and really keep an elderly person safe and sound so that they're not going to be at risk or in danger. Now, everyone's outliving their money, so let's talk ways to pay for it. We know that some people have long-term care insurance policies that might be 20, 30 years old. I know that you've said that you've run into clients recently who there's different language and different policies. How many of your clients are utilizing long-term care insurance to pay for this kind of home care, would you say?
I would say about 25%.
So it's still pretty low, but it sounds like it's climbing a little bit.
It is. And The policies that we typically deal with are the older policies.
Okay.
And some of them have elimination periods.
Right.
Which, when you're talking to family, they don't quite understand what that is.
Elimination period, for those that don't know, is like a deductible kind of time frame where you hire the service and then you might have 30, 60, 90 days that you have to pay out of pocket before they reimburse you back. So, I've found that working with some long-term care insurance policies, I had families when I worked in the nursing home industry that would just throw me in a long-term care insurance policy, and it's like, no, it doesn't really work like that.
Yeah.
It is a benefit.
It is, and a lot of the policies now have a 0 elimination period where they they
nice.
jump right in. But what a lot of folks don't understand is we, as a private duty agency, can't call the insurance company. We can't activate. We can't initiate a claim. Years ago, we could.
Oh, that's changed.
Yes, it is. So it has to be the power of attorney. It has to be the client. So they've made it a little harder. So, if you're sick, you're in the hospital, and you need to activate your claim, you really need an advocate for you.
Right.
You really have to have someone that can speak for you, or you're going to be dealing with this on the phone in the hospital. Because of the HIPAA, it's just something that, we're not allowed to take over anymore.
Well, it's interesting that the insurance companies have made it a little more harder. I mean, I have worked with families through the years that, they want the medical assessment, they want a separate letter from the doctor saying what activities of daily living are required. But I know that after you jump through those hoops, then the care can be easily a little bit more paid for, if not 100%, at least mostly paid for. Now, I want to get into a little bit about the Veterans Aid and Attendance Benefit, because a lot of people that are retired military or the spouse of a retired military member might not be aware that they are eligible for that aid and attendance benefit. Have you run into a lot of veterans or spouses of veterans who have that you can connect with the right providers to get them that money?
Yes. The only difficult piece is once we speak with the family and they realize that, this is a benefit that we actually should look into. Oftentimes that they don't meet the financial piece of that.
Which needs to be $80,000 or less.
Yes, correct. So some don't meet that.
Right. It doesn't include a house or a car, by the way. It's just liquid assets, CDs, stocks, bonds, 401ks, things like that.
And a lot of people, when they're looking at home care, I tell them that, you put away your money for a rainy day.
Right.
When you really start to age in place and you need a little bit of extra help, it's sprinkling. You really have to take a look at your rainy day fund.
Right.
It can't always be paid for by your income that's coming in. So
That's
you really
true.
have to plan ahead and take a look at what's most important. Your safety, of
Right.
course, because you just really do not want to take that fall, have a medication issue, and end up nursing home, hospital nursing
exactly.
home.
And I think that's the goal. I mean, everyone has the whole initiative this year, especially of avoiding hospitalizations and rehospitalizations. And most seniors you talk to, they do not want to end up long-term in a nursing home for whatever reason. One of the things that I have found, and just as a tool, is that elder law attorneys can sometimes get around that financial cap of $80,000 to still provide some of the aid and attendance benefit. We're going to have an attorney on in a few weeks, Jack Rosenkrantz, that's going to be discussing some of the ways that are legal that can be implemented so that they can be set up. He's going to be our guest on January 12th, actually. He's a board-certified elder law attorney, Jack Rosenkrantz, out of Rosenkrantz for Law and Law for Elders here in the Tampa Bay area. He's done a lot of work.
Oh, Jack's great.
Jack's great.
I mean, I actually had a meeting with him a few weeks ago, and I actually thought I knew a lot. I mean, he just blew my mind as far as the new laws and regulations, and he's
the brainchild.
Oh, he knows his stuff.
And his case manager, Brooke Mueller, is extremely excellent to work with. But one of the things, and I'm so glad that he's made time for us, because the laws keep changing every year. And, you know, the federal government and the way that they write up a policy or a program, it's very carved in stone. It's just like Medicare, it's just like Medicaid. They're very carved in stone. But what's nice is that now the elder law world has provided some legal tools that say there's a spouse. And if they're looking at the assets for both of them and the care needs for both of them, that's when they're sometimes able to create a trust and be able to access that aid and attendance benefit. Now, the aid and attendance benefits just gives that eligible person an additional $800 to $2,200 a month. I think the 2016 numbers are $2,120, and if I'm right, I really need a vacation. Definitely. Then I've got too many numbers in my head right now. But so he's going to be in really discussing that. If someone is over assets, I always recommend that they contact a good board-certified elder law attorney and get that legal advice, because there might be some tools of the trade that can help keep you at home and help keep you at home safely and pay for that care. One of the things, too, that I wanted to go through with you, and this might be something that a lot of people are going to be interested in, we are working on our first ever Senior Empowerment and Education Day, which is going to be here in Pinellas County. This has never been done before, but the City of Largo has a Senior Services Division. Now, if you Google every single county in the state of Florida, you're going to find two cities that actually have aging services in the state of Florida, Hillsborough being one and the other one on the East Coast. The City of Largo, independently 30-some years ago, decided to set up a Senior Services Division. And one of the officers that manned that program for over 30 years is Officer Rachel Poinsett. She's going to be our guest, by the way, February 2nd. And all she's going to be talking about is ways to keep seniors from being exploited and neglected. So a lot of what you have found in the homes where the lawn guy's every week, someone's trying to sell them windows. Please save the bunnies in Africa, all that stuff. I mean, everything's going to be addressed. But that event is going to be Saturday, January 30th from 10 to 2 p.m. It is going to be held at the Largo Community Center, which is located at 400 Alternate Keene Road in Largo off of East Bay Drive. On-site respite care is going to be provided for free, and lunch is going to be provided by the Palms of Largo for free. It is free. It is open to the public. However, we are recommending that people register by either calling the community center at 518-3131, or you can go on eventbrite.com and you can get your ticket there. Like I said, it is free. It's open to the public. But just so that we have enough lunches and everything for everyone, that's going to be coming up. So that's one of the events that we're going to be looking at here. One of the things that I have found in working with home care agencies is that you probably, just like there's different types of home care agencies, there was, I had a situation at a consulting job a few years ago where a woman was coming in to apply for a home care agency, and she said that she had been hired by another home care agency that didn't even interview her. Have you seen this? Have you heard this from some of your staff?
I've heard all kinds of things. I mean, they didn't require me to have a CPR. I didn't have to have a background check. Oh, you should hear.
Yeah, it's kind of ridiculous. So when I say shop around and we pull that song in on purpose, guys, it's because not all of the providers are created equal. You do want a legitimate agency that has tried and really vetted their staff, because this person, especially if they're going in to take care of a senior person by themselves, they're very lonely, they're vulnerable, they're at a very emotional state where maybe they've had a lot of losses in their lives, a spouse or a child or a neighbor, or their family's moved away, or the loss of their health. I mean, that's another loss right there. And if you're sending in someone that you really don't know the quality and character of this person, you can pretty much be prepared to expect some problems. So, I mean, one of the reasons I'm a big advocate for home care services, because we as a industry fought so hard to get Medicare to do preventative visits, fought so hard for them to authorize gait training 4 times a year, so that a physical therapist can come in under Medicare, no charge to the senior person at all, but give some strengthening so that they can stay in their homes longer. And now with the introduction and addition of the services your company offers, they can be partnered so that there's a care plan that really keeps them home.
That's very true. And also, typically, physical therapy comes in probably 3 times a week.
Okay.
But what the therapist often does is leaves an exercise plan. So that way we, on those off days, can assist with some of the exercises that may not necessarily be just for the physical therapist only. They may be self exercises. And we help with those to give them 7 days of therapy.
So now that complements, and again, if anybody has worked with a physical therapy program or has worked like I have in the nursing home industry and the assisted living facility industry, when you stop moving, you stop living. You know, the countdown's on. That's when the sand timer kicks in. You have to keep moving. And the more they're moving, the better their mobility is, the less they have falls, the better their emotional and overall wellness is. So it's interesting to hear that your caregivers do that. That's wonderful because they can partner and complement what the doctor's already ordered for them. And sometimes Medicare doesn't pay like they used to. They don't let you go. They used to under Medicare home care. We used to be able to get patients skilled under Medicare home care for 6 months at a time. They rarely allow that anymore. I mean, they're usually pushing for rehospitalization if that was the case. And Medicare home care agencies don't want to risk getting into any fraudulent situations either. So partnering with a good home care agency and a private duty is an excellent plan to keep somebody home longer and also make sure that you've got a human being you can check on mom or dad with and say, hey, what did they eat for dinner? Are they feeling okay? Or do they have allergies to something? Do you have any bilingual caregivers that you work with at all?
Actually, yes. We have caregivers from the Philippines. We have caregivers from the Baltic states, so they speak Russian.
Oh, wow.
We have some Spanish caregivers as well.
Okay.
It's not... I would say probably the need is probably 3% of the clients that we care for. Most are obviously English speaking.
Right.
But, it's there just in case anyone should need it.
And it is interesting because if you can partner a caregiver that, like you said, speaks Russian, they probably also cook Russian.
Yes, there you go.
So that client of yours is going to get a real partner in their healthcare journey on a very, personal basis. And I think it's amazing that we've come this far. I really am so glad about that, that we've gotten to the point where we really have a lot of options. I was talking with somebody yesterday, it was a colleague, and she was floored by the fact that Pinellas County has over 5,500 nursing home beds. And she's like, that can't be. And I said, no, it's true. Do the math. Go line up the facilities. It's over 5,500. And then I, for fun, I was bored one day, and I tried to find out why did we have so many nursing home beds in Pinellas County. This is crazy. And the reason is because most of them are over 30 years old. They were built a long time ago when our grandparents and great-grandparents possibly or potentially were retiring here in Pinellas County, and there was no assisted living. It was just you were home, and then you went straight to a nursing home. The nursing homes used to be run like hospitals. And so now what we've found is a shift all the way across our board. The hospitals only let you stay 3 or 4 days for most situations. Then they are immediately kicking you into a rehab center. The rehab centers have a higher acuity level than they used to. And so then now we have all these alternate home care options and assisted living component options. So it's shifted our demographic over the last 30 years tremendously in the Tampa Bay area. So
and the memory care piece. There is so much memory care, which it's really badly needed. They need the 24-hour supervision. They need that nursing piece. It's nice to have a facility that focuses on the neurological issues that they have, and they're experts with that.
Oh, I couldn't agree more. It seems like the way assisted living facilities were built back in the 25 years ago, we just locked them up. If they were exit seeking, it was a little mini jail. We just locked them up. Okay, we can't let them run out into the street because they'll get hit. So now having dedicated memory care centers like we have in our communities is really a nice new feature. But a lot of families are really resisting and pushing back from going into the next communities. We are going to have a whole show dedicated to assisted living, senior housing, and memory care centers, and I'm going to have Cynthia Delancart from Princeton Village of Largo be our guest that day, and she's going to really be discussing there's so many different licensures for these facilities and how to navigate those decisions when we get to that point.
That's very true. A lot of people think it's a one-stop shopping, that they're all the same. They're not. They're very, very different.
Now, do you go into any independent living communities, or do you have clients that are sometimes in senior apartments that might need assistance?
Yes, we take care of several. We have about 30 clients at the Fountains at Boca Ciega Bay in Independent. We also take care of folks that are actually in assisted living.
Oh, wow. Okay.
Believe it or not, when folks are, families, put mom or dad in assisted living, and the reason I say this, I spoke with a family member a couple weeks ago that she had come in and she said, we're looking for extra help in the assisted living. She says, we thought that they were going to get more help than they.
That does happen sometimes. Right.
And what a lot of people don't understand is, yes, they can still fall in assisted living because there's not someone with them 24/7.
It's not one-on-one care.
No, it's not one-on-one care. So, you have to take a look at what is the ratio, how often they're going to check on mom or dad, and, how independent are they in assisted living.
Right.
So,
and I always talk about this, the river of denial that a lot of our families and even our elders sometimes have gone through. My experience has been the ones that are practical about their limitations and are kind of in the families that are willing to have those hard conversations about, mom or dad, come on, it might be time to get you some more support, get you some more care. They seem to sail through these decisions a little easier than the ones that are fighting it. One of the things I've seen over the last 20 years is sometimes by the time somebody starts shopping for independent living, they're really more qualified for assisted. Sure. And sometimes by the time they're shopping for assisted, they might be only eligible for an assisted with extended care, congregate care, being the ECC license, or even a nursing home.
Yeah, they're a step away.
So sometimes they've waited too long, and it's a window. You get a window when you're growing older and home isn't working anymore, and you need to make those decisions. But I am glad to hear that you do go into the facilities, because that is a topic we're going to be discussing in a few weeks, where really you need to shop around and look at the ratios of the staff and understand that especially if you're a caregiver yourself for a parent or a loved one, I think they go through so much separation guilt and anxiety when they pass the baton to someone that it's really hard for them to, cut the umbilical cord a little bit.
That's very, very true.
And it's really important that they have a realistic plan in place of what my loved one's going to get. What are they going to get here?
But I also say, have that conversation earlier. It seems as though, families are flying into town, mom fell, she's in the hospital, oh my gosh, what are we going to do? We got to do this.
It's panic mode. It's crisis.
And there's no plan. We all know our parents are getting older.
Right.
It's just a topic that nobody really wants to discuss. And having that conversation with your children, or your children having it with their parents, elderly parents, you've got to start the talk. You've got to, what are you planning, Mom? Do you want to stay at home? What are we going to do with Dad?
How can we afford it?
Exactly.
Let's count the cost
Is there
of
a
everything.
plan? Are you going to go move back up north?
Right.
Having a plan A and a plan B, at least starting to talk about what you're going to do, is very important. Also, interviewing home care agencies well in advance of the need.
Right. I know a lot of them do pre-need contracts. Do you do those as well?
Typically, no, because things change so often.
Oh, that's true. I do.
What we do is we'll talk with the family, we'll talk with the client, we'll go through. We answer any questions they have. They need to be able to have a plan in place. So if that happens to mom, this is who we call.
Right.
So it's not a panic mode.
Right.
We have it covered.
Yeah, and I know that I've dealt with some seniors and families that, boy, they're on it. They know, okay, this is what hospital I want to use. This is where my doctor is. Mm-hmm. This is where my long-term care plan policy is. God forbid, knock on wood, anything happens, I'm going cremation or I'm going to this funeral home with my husband. Those types of families tend to handle the situations and the emergencies a little smoother. Mm-hmm. And that's one of the big things that us as a healthcare industry really try to educate people in the community on, that the more prepared you are, the easier it is for everyone else to help you.
It's true.
That, we know what your wishes are. Everyone who's gotten into healthcare, they didn't get into healthcare because they wanted to run, a stocks on Wall Street. They got into healthcare because they're natural nurturers for the most part. Mm-hmm. And they do want to have happy patients and happy caregivers and really feel a sense of worth for their jobs. So I would encourage anybody who is needing or thinks that at some point they're going to need some services to contact Sue Ross here at Always There Home Care Services. They've been in business since 2006. Honey, that's almost 10 years. I don't know how you're doing it, and you look great. You look great.
Thank you.
That's a 7-day-a-week job. Holy cow.
It is.
Well,
but you have to love what you do.
Yes.
I mean, you really do.
And then you don't work a day in your life, right?
I love what I do.
Yeah, you can tell it really shows. If you're interested, you can go to their website. It's alwaystherehcs.com. Or you can give Sue Ross a call at 727-547-2500. 547-2500. You can tell them that you heard about it on the Karen Rizzo Show. She's here today. She's been at this for close to 10 years, and that is a real accomplishment, especially to be able to maintain the staff, because, a lot of agencies go through a lot of staff, and I've heard this in the industry that they didn't feel they were getting the right pay, the right jobs, the right shifts. And then, of course, what you were saying, some of them didn't even require any education, which is, ludicrous.
Mm-hmm. It's very true. It's very true. I mean, there are accreditations out there. One of the things that people don't realize is, you say, oh, I'm certified. Well, in order to become a new agency, the state requires that you have to go through that certification.
Right.
Because years ago, you could go through the state certification, but then they were overwhelmed by the number of applications for,
right,
assisted living, home care agencies, that type of thing. So they basically kind of gave that off to another agency. So,
did you hear that the star ratings are coming?
No, I haven't. Oh, for the Medicare piece.
For the Medicare agencies starting next year are going to be getting through they're going to be getting a star rating, just like nursing homes do and assisted living facilities do through the state of Florida. And then private duty is on the books to start becoming getting a star rating as well, which means every agency has to go through surveys. And it's basically kind of like a little snapshot of how well they did for a survey.
Yeah, we've been deficiency free since we started. So we pass with flying colors every time.
Knock on wood, because they dig up every single piece of paper when they come in for these surveys.
Oh, it's like pile up the charts. They go through everything.
They do. They go through everything. Yeah. Well, we're going to start closing out some other things. Just in case you've missed any of the shows so far, which the last couple ones, this show and also the first show we had on handling depression through the holidays are going to be over the next 2 weeks discussed. And then upcoming shows, we're going to have a piece on January 12th with Attorney Jack Rosenkrantz, Elder Law. We have a gentleman coming in to discuss electronic and personal health records, which is a whole shift our industry is going to have. Everything's going digitalized, guys, including the Tan Talk Network. And then we're going to have also a couple other guests talking about, one in particular, Monica Stenchula is the CEO of a company called Reunion Care, and it's an online tool that families can use to set up a whole circle plan of care for their loved ones so that all the relatives out of town can know who's taking care of mom and dad, when their doctor's appointments are, what their social activities are. So that's going to be all kinds of fun. If you're looking to get more information on a one-on-one basis, you can always call Sue Ross for home care at 727-547-2500. You can also go through my website, agingguidebook1.com. And then you can also use Instagram, which is at Karen Rizzo Show 1, or YouTube, and you can see any of the YouTube shows at The Karen Rizzo Show, Karen with a Y. I'm sorry, my parents were hippies. Can't help it. Had to be different. So if you're interested in a book and you don't have access to the internet, and I know we have some old school folks out there, you can always send a $19 check to Elite Marketing at P.O. Box 7221, Seminole, Florida 33775. And this practical resource guide took over 5 years for me to develop, but I do keep updating it every year to be able to have a resource guide that families and seniors can utilize and make the best choices. So one of the things you want to remember is that we're all aging, and the goal of this show is hopefully that it helps us all to do so a little more happy, healthy, wealthy, and wisely. So for those that are going to be tuning in over the next 2 weeks or online, feel free to contact us. If you'd like more information on a one-on-one basis, you can still call me personally at 727-452-1300. And also, all of the shows have a podcast through the tantalknetwork.com. So you can feel free to utilize any of those. Feel free to contact Sue. And also, there's one more event ARP is sponsoring Wednesday, December 16th at the Doubletree Hilton in Tampa, 6:30 to 8:30 for caregivers. We appreciate you tuning in and hope to see you next week. Have a wonderful holiday.
Thanks for having me.